I'm Franco Cappuccio, Professor of Cardiovascular Medicine and Epidemiology at the University of Warwick, and I'm also a consultant physician running a hypertension clinic in Coventry. I'd like to talk about the importance of the early approach to your patient at the time of a diagnosis of hypertension on the basis of a few considerations. First of all, hypertension, as you probably are aware, is not a condition that is set by biology. In fact, what we have is a measure of blood pressure, which goes from low to medium to high across the population. And then over time, we draw a line and say, we define somebody having hypertension, so make a person a patient. So we start medicalizing the individuals on the basis of a cutoff point that, as you know, is decided and moved according to evidence and health economics in order to dispense drug therapy and try to prevent the risk at that level. But in principle, as you probably know, most of your patients will come to you at a time where you will measure the blood pressure, maybe for other reasons. The person will be completely symptomless and will be healthy, and younger, as you know, as we go along with greater incidence at younger age. And yet you will tell somebody who is normal, who has no symptoms and no particular illness or complication, that he or she will have to take tablets for the rest of their lives. This is something which is not in the normal paradigm of medicine. Although it applies to more than one aspect, it's not just hypertension, I think it will raise a couple of considerations. We know that obviously it is a concept that needs to be given to the patients we diagnose as hypertensive, that they'll have to continue for their lives taking their tablets. And we know that concordance is one of the major issues, and lack of concordance, one of the major problems we have at the moment in trying to sustain the protection of drug therapy in somebody's lives. So I think it's very important that we establish early on a good relation with the patient and a sort of virtual contract whereby your advice and the trust between you and the patient will be delivered to your patients, who eventually has to, let's say, be concordant with your recommendations. And I think one of the major aspects is to make them understand what is the reason for needing to take tablets before they develop disease. Obviously, one of the aspects is that we are treating a risk factor, which is the major cause of further illness and perhaps premature consequences, very often irreversible. Let's think about a premature stroke, non-fatal stroke, that may leave disabilities. We may think about a heart attack, which of course may not be fatal anymore, but may leave limitations in their lives that definitely are not reversible back to normal. So at that stage, it may be a very powerful motivation for the patient to understand that the way they take their tablets is like the way of paying an insurance premium that will be paid off later on. The next is make sure that the tablets you eventually settle the patient on will be very effective in reaching targets, will be absolutely well tolerated with no side effects. So I think the first stage is unusual, and we should make an effort to make sure that patients do understand the reason why they should take tablets and feeling well. And one of the aspects that I tend to suggest that we're treating somebody to prolong well-being rather than to prevent disease.